I'm Lynda Balneaves. I am a professor at the University of British Columbia, and I also am the principal investigator of the CAMEO program, which is the Complementary Medicine Education and Outcomes program that's at UBC and the BC Cancer Agency. Complementary medicine are medicines that are used together with conventional medicine, and it ranges everything from vitamins and minerals to herbal remedies, to mind-body therapies like relaxation, to massage, all the way to the whole medical systems like naturopathic medicine or Ayurvedic medicine or traditional Chinese medicine. Alternative medicine, though, is when we use these therapies in replacement of conventional medicine. Complementary medicine is definitely a complement to conventional care, especially if you're looking at more of the psychosocial realm and the supportive care aspects. So if someone's undergoing conventional treatment like a chemotherapy or a radiation, you might find that taking a meditation course or a relaxation course can really help you with some of the stress and anxiety that you may be experiencing. When it comes to natural health products, you have to be a little bit more cautious because we do know that many of these therapies do work in our bodies and that they can sometimes negatively interact with the conventional medications that you're receiving. So you have to use those types of therapies cautiously and make sure that you're consulting an expert in the area to make sure that there aren't any negative side effects. It can be really tough finding a complementary medicine practitioner that you trust and that you feel safe receiving care from. We usually tell patients to try to think of some key questions. And one is to ask that person what their training is, where they're trained, do they have any specialty training in their area. Often it's good to also ask, have you cared for many people with my type of condition? And if so, how has that been? How's your success rate been around working with those patients? Also, if they do recommend a plan of care, ask them what the evidence is around that. And it may not be, randomized clinical trials. It may be experiential. It could be traditional knowledge that's passed down. But it's important to at least know what that evidence is. Very few people make the decision to go to alternative medicine. We only see about 5% of cancer patients overall that make that decision. It sometimes happens, though, when treatment options become very limited in conventional care, and patients are being told that there's not much more that can be done. And that's when people will turn to alternative medicine. It's a decision not to be made lightly. Unfortunately, we do not have any complementary medicine at this time that is as effective in addressing cancer as we do in conventional care. So chemotherapy, radiation, and surgery are still our best options if you're looking for cure. I think the important part of receiving complementary care is that you understand what the potential side effects could be. You know who should and should not be using these therapies, and just what the risks are. And being aware of them and then monitoring for those risks, I think, is incredibly important. I think often people make a decision and then they don't really follow up on it and really try to make sure. And so keeping what we recommend is a CAM diary, where you're actually keeping track of what you want this therapy to do, what are the potential side effects, and then each day or whatever to really follow up and to see whether you're experiencing those side effects and whether it's having the effect that you actually want. And so that is one way to definitely monitor the safety of using these therapies. I think the other important issue around complementary medicine is the importance of disclosing your use to your conventional provider. And because there is potential for interaction with conventional medicine, because there can be side effects of these therapies, it is important that your care provider, no matter who they are fully aware of all the different therapies that you're using, be they conventional and be they complementary. It's really important that patients say, I simply want you to know what I'm using and have it documented, just for any safety or concerns that could arise in the future about my care, just so that you have good documentation of it. I recommend that patients share with their providers the names of all their different healthcare providers, be they conventional or complementary. So again, that's part of the official documentation in case there ever needs to be a phone call made or any kind of follow-up made. I think we can't discount the importance of complementary medicine in preserving hope for patients and for families. And hope can be incredibly important. And we often say, our human trials are based on these placebo-controlled, trials where, the placebo effect, we're acknowledging it. To me, placebo effect can be 25 to 30%. And if that effect can help people live longer and do more things that are important in their life, and they're using a therapy that is safe and isn't having huge negative side effects in their lives, then I think we have to be supporting patients in pursuing therapies that are allowing them to have hope and giving them that possibility of perhaps living longer. And so I don't think we want to discount complementary medicine on the other hand because of just its psychological effects.
Bye.